Assalamu alaikum. The communication day. First scenario, Mr. Ahmed, 65 years old, has been diagnosed with stroke due to AF, atrial fibrillation, and he's started on Apixaban. The patient want to talk to you. Please, you are the senior house officer in the stroke unit. Yes, you can start, Dr. Ala.
Okay, hello, I'm Dr. Bitwali. I'm the medical doctor in the brain department today. Sorry, let me confirm you are Mr. Ahmed.
Yes, doctor.
How can I help you, Mr. Ahmed?
Doctor, actually, yesterday I came to the hospital because I have weakness in the right side of my body, and the doctors tell that I have a stroke. And actually, doctor, they told they will start for me treatment called Apixaban. I researched about this specific treatment, and I'm really worried to take this medicine, doctor, because I heard it might cause
Uh,
bleeding.
yeah, I appreciate that, Mr. Ahmed, and I understand your feelings and concern. If you allow me, I can explain to you more about your condition and that treatment, so you can understand more about it.
Okay, doctor. Okay.
So, Mr. Ahmed, as you mentioned, you have been admitted yesterday to the hospital with that weakness in your right side of the body, and this weakness is caused by a blood clot in your brain. Okay, that we are calling it a stroke. Okay, this stroke after we did some investigations to you and we did scan to your heart, we found that you have a condition called atrial fibrillation. Have you ever heard about it, Mr. Ahmed?
No, doctor, no.
This atrial fibrillation, sorry for this, is a medical term which means that there is like abnormal heart racing. Okay, so the heart is not acting in a proper condition, which causes stagnation of the blood in one of the chambers of your heart. Okay, this stagnation of the blood causes formation of blood clots. Okay, and the stroke that happened to you mostly from one of the blood clot that was in your heart. Okay, so that's why we prefer to start you in that medicine, which called the Apixaban. This Apixaban is a blood thinner. Okay, this blood thinner will help to reduce this event from happening again. Are you getting me, Mr. Ahmed?
Yes, doctor. But I'm really afraid because my doctor told me that because I had this stroke, so I might have a risk of recurrent falls. And if I fall, I might develop this bleeding. So I'm really afraid to take this medicine, doctor.
Yeah, I appreciate your feelings, Mr. Ahmed, and also I understand what you are going through. Actually, as you mentioned, one of the bad effects of the Apixaban is a bleeding. Okay, it can cause bleeding. Okay, but uh, all of the medications that we are prescribing, they have benefits and they have bad effects. So weighing the benefits of that drug or that medications with the bad effect that it may have, the benefits outweigh the bad effect. Okay, as the risk of that you will have a blood clot again in your brain, it may be high, especially you have that condition that I mentioned to you. So it will be in the best interest of your condition to start on that treatment to prevent that from recurring again. Based on the bleeding or the bad effect, we will monitor you regularly, okay, on a regular basis to check that you will not have such bad effect, which is bleeding, uh, which may appear in like maybe like minor bleeding and some condition, maybe severe bleeding. In that condition, we can give you a medication directly to reverse the effect of such drug and prevent the aggravation of such a bleeding. But uh, as I mentioned to you, Mr. Ahmed, the benefits of such a drug outweigh the bad effect that we are expecting to come with that. So it's in the best interest of your condition. So what do you think about that, Mr. Ahmed?
Okay, doctor. Okay. Okay, I understand now.
So, Mr. Ahmed, can I ask you some questions? Uh, okay, Mr. Ahmed. Mr. Ahmed, do you drive?
Yes, doctor.
Okay, so I advise you, Mr. Ahmed, now to stop driving, as driving will be dangerous because of your condition now. And I will refer you to the DVLA to give you the proper advice for how long you will stop driving until we do assessment for you and for the weakness that you have. And then they will give you the proper advice to resume driving again. You're driving your own car or?
Yes, doctor. It's my own car. Yeah.
Okay, so they will give you the proper advice about it. Mr. Ahmed, do you smoke?
Yes, doctor.
I highly advise you, Mr. Ahmed, to stop smoking as the smoking is very dangerous to your health and also it's dangerous to your condition regarding the heart problem and also regarding the stroke. The smoking increase the risk of clotting formations and also increase the risk of strokes also. So I highly advise you to stop smoking. And if you think about it, we can help you by referring you to a smoking cessation clinic to help you regarding that matter. Is
Okay.
that okay with
Okay.
you?
Okay, doctor. Okay.
Okay, so Mr. Ahmed, to summarize what we have discussed today, uh, we you have developed that weakness in your right side of the body because of this blood clot in your brain. And as I mentioned to you, that was originated from your heart because of abnormal heart racing that caused the stagnation and blood clotting in the heart. So we prescribed for you this blood thinner, which is Apixaban, in the best interest of your condition to decrease the risk of recurrence of such condition. Okay, and as I mentioned to you, if any complications happened anytime, we will do regular follow-up for you to detect any complication that will happen and to treat it immediately. Uh, do you have any other concerns, Mr. Ahmed?
No, doctor. No, I'm okay.
Okay, and I will give you now some leaflets and brochures and also website to read more about the stroke and also this medication. Uh, and if you need any help if you have any queries, don't hesitate to contact us again.
Okay, doctor.
Sorry, Mr. Ahmed, can I know how much did you get from our discussion today?
Yes, doctor. I understand that I have to take this medicine because it's very important to prevent the recurrence of my case, the stroke again. And yeah, I need to start it. And the risk of
2 minutes left.
bleeding, yeah, and I understand that the risk of bleeding, it's minimum in this with this medication. So yeah, I understand the case. Yes, doctor.
Okay, Mr. Ahmed. Thank you, Mr. Ahmed.
You are welcome.
You have still 1.5 minutes. What missed in the social and personal history? Dr. Ala, you did
Uh,
great, but you missed two things very important in the history of or the occupational and personal.
so, Mr. Ahmed, can I ask you what do you do for a living? Yes.
Yes, doctor. I'm retired.
You are retired. سهلها عليا جدا. Okay. Okay, Mr. Ahmed. Okay, with whom you are living, Mr.
Actually, doctor, I'm living alone in my apartment. Yeah.
Yeah, Dr. Ala.
Ahmed? Hello?
Yes, we can hear you now. Can you repeat the question, the last thing?
Yeah. With whom you are living, Mr. Ahmed?
I'm living alone, doctor, in my apartment.
Sorry?
He's living
Hello?
alone. Yes,
Yes.
we can hear you, Dr. Samia, but
Yes.
Dr. Ala, we cannot hear
Yes,
you. Now you can say
Mr.
yes.
Ahmed. So you don't have anyone to support you at home?
No, doctor, no.
Okay, Mr. Ahmed. So I will arrange with the social worker. Okay, we'll do referral to them to try to solve this problem for you and to check if anyone can help you and support you at home during our management until you are independent and you can take care of yourself.
Okay, doctor. Thank you.
Okay.
Okay, good job.
Okay.
What if you have extra advice? What extra time to advise? What advice you can give? Any
Advice.
advice? Yes.
Healthy diet, lifestyle.
Okay, regarding his concern particularly, his risk of bleeding and he's afraid of bleeding. Any
Yeah.
safety netting?
Yeah. Uh, to take care of violent like contact sports or that uh, or like violent behavior like that. Anything to increase the risk of bleeding.
Perfect. Yes, that's enough. Yes. Halas, you understand the point, so it's enough to mention
Yeah.
avoid any contact or something can lead to the bleeding. Okay. Or trauma and then for the bleeding. Well done, Dr. Ala. Well done, really. As first
Yes.
communication. Yes. Dr. Samia, yes, you can comment now.
Yes, very nice. Very nice. You did it very nice, actually. Just a little bit. I want to comment to make it more perfect. But
Okay.
you covered all the part that we needed to discuss, actually. Just the first thing, the patient is already in the hospital, so he came from yesterday. So just to make sure that you are familiar with the patient, you can start by telling that I have, hi, Mr. Ahmed. I have been told that you want to talk to me. So how you are feeling today? And then you can start. Okay. So just the patient
Okay.
is already here in the hospital, not the first time you can see. Okay. The
Okay.
second thing, yeah, you explained very well about um, the stroke and the risk, the cause here of the stroke is atrial fibrillation. You explained very well, and then you tell about the complication that if you don't take this medicine, there is a risk of recurrence of this stroke, and the risk here is very far when we compare with the risk of bleeding. Okay. So the
Okay.
thing that you need to do also is told about the benefit of taking Apixaban. So you can explain that yes, if you are, I know that you are concerned and worry about taking this medicine, um, but Apixaban has shown that it's a better safety profile when compared to the old blood thinning medication, uh, mainly the warfarin. So yeah, it's considered the safest medicine and with the minimal risk of bleeding. Okay. And then you tell him even
Mm.
this medicine no need to do monitor like the blood thinning test every month like the warfarin, and also there is minimum risk of interaction with other drugs. Okay. So you can make
Okay.
the medicine is more beneficial in, especially in your case. Okay. Then yeah, he when he said to you that I have my doctor told me that there is risk of fall. So yeah, you this is considered also a concern. So you can tell him that we can help regard that. We can involve the occupational therapist and the physio. So here you have to mention the team, okay? Occupational therapist, they can help you to do some adjustment and special arrangement at your home, so we can minimize the risk of bleeding, okay? And also
Yeah.
you can, yes. So this is also considered as a concern. You can tell him that they can review even they can review your medication, improving the balance, and also using mobility aids. So you might be safe and decrease the risk of fall, and so decrease the risk of bleeding. Okay, so just
Okay.
this fall story also considered as a concern you need to answer. Okay, by the help of the multidisciplinary team, including the occupational health department, occupational health therapist. I mean, okay.
Okay.
And yeah, you already told me about the safety nets. So yes, if you had any fall, please come to the hospital as soon as you can. We can do for you some tests to make sure that there is no bleeding, and if there is bleeding, we can reverse the effect of this bleeding by giving antidote medication that can reverse the effect of bleeding. Okay, so the Apixaban has antidote. Okay.
Mhm.
Then yes, regarding the social, yes, he is living alone. So yeah, you can tell him anyone from your family can come to you and help you regarding this issue. So yeah, he might say yes, okay, and he said not. We can arrange the community nurse. She can visit you at home every like 2 days in week or something like that. So to be sure that she can help you regarding this. Except that you did very well, mashallah. You cover all the concern. I don't have other comment, Dr. Basim.
Yes, perfect comment,
Thank you,
Dr.
Dr.
Samia
Salman.
as well. Yes, very nice comment. I will add to
Thank
Dr. Samia comment the age of the patient. You confirm the patient name only. You said Mr. Ahmed, and you proceed without asking his age. So you have to confirm with two data, the patient age and the patient name. Okay, you can
So
ask
every time
initial.
we confirm the patient age with the name,
Yes,
because
every
some people are
station.
telling that especially
No,
the
no,
females they don't like to tell their age
no, no,
or
no, 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 no,
uh,
at all. Every station, even in the short, if they wrote for you the patient and age, you can confirm it in the short station. Okay,
okay,
and to
okay.
confirm yourself, of course, introduce yourself. I am Dr. X. I am one of the doctors here. Okay, better than saying I'm in the department you don't know, or you are having difficulty to introduce yourself. As I prefer usually say I am one of the doctors here whenever and whatever the department, whatever the position. So I am one of the doctors here. This is the best and the easiest way to introduce yourself. Okay, the patient
Mhm.
name and age, and the you didn't ask earlier about you asked about the what he has, but you didn't ask about the expectation. That's why you have extra minutes at the end. So what's your expectation about?
Yeah,
Yeah,
I
better
thought she
to
will be more resistive about the medicine and will explain more about the
even
medicine and side
even
effects.
you she will be resistant. You will know why she's resistant, and you already address it while she said I have fearness of bleeding. So you can ask the
Yeah, so
expectation, even if she is resisting. At least you can address the first concern earlier from the start
yeah,
by the expectation. And I prefer not to repeat what she mentioned to you. Doctor, I have a weakness yesterday when I present, so no need to ask her. Yes, you presented to us with weakness because she mentioned already what the benefit of repeating this. And instead, you can say, and how you feel now. Are you okay today? How is the weakness today? Like this, okay? So you are
okay,
listening well to the patient. You are not repeating, and in the same time, you are in the same page with the patient. How's your weakness? Is it okay now? So it will show the examiner that you are following the patient, not only repeating the things, okay? The second or the
mm,
third point, stagnation. I don't know, is it something complicated word? You can say slow of the blood, or even your blood being stopped or very slow in the chambers of your heart. I, I'm I am not sure about stagnation. Is it something to be easy
mm,
understandable? Stagnation, because yeah, you're right, but it might be like a complicated word. So
yeah.
yeah, either slow of your heart speed, or the heart the blood, sorry, speed,
So
or the
blood
flow
flow.
of your, yeah, the flow of your blood in some of the chambers, or some of the rooms in the heart being stopped, or even very slow in the rate. And in this way, it might lead to blood clot in this area of the heart. After that, it will run away from the heart to the brain or to another organs. But in your condition, it runs or it travel to the brain and it leads to the weakness and the stroke or the stroke and further the weakness. I agree about the rehabilitation program. Yes, the physiotherapist, limb physiotherapy, occupational therapist, they should be in the one of the team. Apart from that, you cover the whole scenario, so you don't have any major defects. Safety netting you should remember by yourself because it's one of the major fearness point of the patient. I am worried of bleeding. So how to avoid the bleeding? Not to stop the medication because the medication is essential. And I like when you said the best interest. Always say this word. It's the best interest. We are giving the medication in the best interest of your condition, as you mentioned. And whenever you have patient doubting about the medication or about anything investigation, always weigh the benefit and the risk, as you did exactly. So the risk always or the benefit always outweighs the risk. That's why we are going with the benefit and with the medication. Anytime the risk will be outweighs the benefit, we will not do this procedure, we will not do the surgery, we will not start the medication. Another thing very important, and you did the approval of the patient. What do you think? Are you agree to proceed with this medication? Yes, doctor, I agree. And she already you asked this question. But you forgot the alcohol. Whenever you ask about smoking, ask about the alcohol. Smoking and alcohol together. Alcohol itself can lead to dyslipidemia, and the patient again will have atherosclerosis. So you have to address the smoking, atherosclerosis as a risk factor, as well as the lipid of the alcohol, which also one of the risk factor for dyslipidemia. The last thing, don't ask him what you are driving either to ask him, do you drive? Yes, I'm driving. And the good thing you also you refer him to DVLA. Even in the stroke, sometimes you can say to him, you can stop driving until you will be reassessed again after the stroke. No need to refer him to DVLA. Some patients will regain the movement. Anyway, it's not the major issue to refer to DVLA, but you can tell him to stop driving. My point is, no need to tell him, are you driving bus or why? Because you can ask him in another question, what's your job? That's why you miss the job because you ask if you are driving a bus. So if you want to ask, do you drive? Yes, doctor, I'm driving. No need to ask what the vehicle you are driving. You can ask it in another question, what's your job? If he's, for example, bus driver, he will tell you, yes, I'm bus driver. Okay, so what you are driving? I'm driving. Okay, or he will tell you, yes, I have my own car. But don't volunteer to ask him what you are driving. Instead, you can ask him, what's your job? He will tell you either taxi driver if his job is driving, for example, or driver. So he will tell you, I am driver of bus or taxi driver or whatsoever. You got it, Dr. Rana. So be smart while asking the question. Don't
Yes,
make the
yeah, yes,
question.
yes, Dr.
Okay,
Basil.
okay. Otherwise, really, it's as a first time communication practice with me, you cover the most important thing in this scenario. Thank you and well done, Dr. Ala. You can post your scenario for Dr. Samia to be ready. Okay, Dr.
Dr.
Naida.
Basim,
Yes, sure.
sorry, I want to ask one question.
Yeah,
In
sure,
this
Dr.
case,
Sam.
need to stop driving? Sorry,
Yes,
maybe I
yes,
missed
yes,
some of
yes.
the session. Need to stop.
Yes, I will tell you something. Any patient with acute illness, particularly those with acute weakness, he has weakness, right? If this
Okay,
weakness will be improved or not improved, you don't know when he will be able to drive back. So you will stop his driving till he will be reassessed after 1 month, for example. The stroke and the MI, heart attack, all the things in the acute state should be stop driving until he will be safe or he will be reassessed again after 1 month. But temporary for 1 month, all these patients will stop driving. Clear?
okay. Thank you.
Yes,
Yes.
most welcome. Any other question or comment? Dr. Samia, I will read for you the scenario, then I will open the discussion back. You are the doctor in the neurology department. Mr. Richard, 67 years old, was admitted with urinary tract infection and he is improving and planned for discharge. He was diagnosed with Parkinson disease, but not on treatment. The medical team noticed that His condition deteriorated and the consultant prescribed levodopa carbidopa. Explain the diagnosis, the management plan, and the outcome, address his concerns. Try to explore quickly, briefly about the levodopa carbidopa, the most common side effect, because you have to mention them in between. Okay, doctor? Yeah, nice scenario. I agree. It's one of the nightmares of most of the doctors, the anti-Parkinson medication. Yeah. Get ready, Dr. Samia, then we'll start.
Okay.
Back to the comment of Dr. Maida. Normally, we use DOB. What do you mean by DOB? Date of birth, you mean?
Yeah, date of birth.
Okay, for the confirming the
Mm.
patient data. Okay. But the age, much easier. I think the day of
If
date
we
of
have,
birth.
if we have according to the scenario, if they just give the date, the age, we'll use it.
Sorry?
But
Yeah,
normally
exactly.
to confirm date of birth,
Yes, you're right.
they are
Maybe in the practice, you mean in the practice live, you can ask for the date of birth. Okay. Other comment, Dr. Maida?
No, I
Okay,
think
anyone?
you cover everything. I just my comments in the scenario.
Okay.
I like the way he's talking, confident and very
Yes.
systemic and very clear. So it was very nice.
Yeah, I agree with you. Thank you, Dr. Maida. Anyone with other comments? Hey, when you're ready, Dr. Samia, let me know. As general advice, any patient in acute state, you have to reassure him with a program, what he will receive or what he will undergo after the improvement or to be improved. I mean, in this scenario, rehabilitation. After MI, there is cardiac rehabilitation. So every patient with acute state, he should be followed by a team. One of them, the rehabilitation. You can mention occupational for the fall, as in this scenario. You can mention limb physiotherapy, the same for this scenario. So always remember the follow-up post the attack, the care you can provide to the patient post the attack. Even the appointment clinics, you can mention it. It's something not to be harmful, and instead it will add marks for you. You are showing the examiner that you are caring in the future. You're just not just taking care of the current condition. No, you are thinking about his future. So you are reassuring him, don't be worried. We will be with you. We will take care of you. We will have a follow up with you, and you will be under our monitor. For example, in this scenario, we'll take care of your blood and blood thinning. All the things will reassure the patient as well as it will impress the examiner. Okay. Are you ready, Dr. Samia? Or still you need some minutes or some seconds?
Okay, let's start.
Yes, here you go.
Okay, hello.
Hello?
My name is Dr. Ahmed. I will be the treating doctor for today. May I confirm that you are Mr. Richard and you are 67 years old?
Yes, doctor.
Mr. Richard, we are here to discuss some issue regarding to your health and answer any concern if you want. Are you okay with that?
Yes, doctor, no problem.
Okay. Mr. Richard, can you tell me what do you know about your condition so far?
Actually, doctor, I had that painful micturition all over the previous days and some fever, and I was admitted to the hospital. And thanks to your care, my condition is getting too much improved, and I knew that they are planning to discharge me home.
Yes, Mr. Richard. What do you expect about the discharge plan that we will do for you today? Do you have any expectation?
No, doctor, I don't know that much, but I know that my condition already improved, and that's a good thing.
Okay, Mr. Richard, do you know that you have a condition called Parkinson before? Anyone told you
Yes,
that?
doctor. Yes,
Mhm.
doctor, I have been diagnosed with Parkinson like
Mhm.
2 years ago, and I had that shaking of my body, and I
Mhm.
just was coping with it.
Okay, so do you want me to explain this disease again for you?
Okay, doctor, no problem.
Okay, so yes, Mr. Richard, actually, yes, you came here to the hospital with the infection in your waterwork, and hopefully it's improved and your symptoms is okay. But what we were concerned about, actually, the Parkinson that you have, which medical condition in which there is a long-term problem affecting your brain, having some issue in your movement, shakiness in your hands, and yes, other symptoms that might come with this condition. It also might affect your blood pressure, causing that sudden drop in your blood pressure, and also other symptoms.
Oh.
What Yes, I'm so sorry to tell you that, Mr. Parkinson. What we noticed actually that the symptom of Parkinson, it's really increased in your condition, and
Yeah, doctor. Yeah, I noticed lately that my shaking is being increased, and also I noticed that I'm being more stiff than before.
yes. So
Mm.
this is actually that mean that the increasing symptoms of Parkinson that's required to start the treatment. So our consultant and medical team actually decided to start for you a new medicine. Are you following, Mr. David?
So there is a treatment, doctor, for such condition?
Mhm. I really appreciate your
Mm.
concern, Mr. David. This is a very nice question. So yes, there is a treatment given for this condition, but to control mainly the symptoms. The condition in itself, it's not treatable, but we can
But why, doctor? Why no one give me that treatment before, doctor?
Yes, I really understand that this is a very valid question, Mr. David. So your symptoms, maybe when it begin, it's minimal, and that you can cope with and can control your movement. There is no a very like symptoms that make you difficult to function at your home or like that. So they not usually start the treatment unless there is increase the symptom of this Parkinson that may affect your daily activity. So I think now your symptom is increasing and it's request to start this medication. Am I clear, Mr. Richard? You want me to repeat anything?
Yes, yes, doctor, but is that condition serious?
Yes, I'm so sorry to tell you that since your symptoms start to be worse, so it might be complicated more than that. It might lead even to more serious issue that can affect your swallowing. It might affect your speech, and it might affect your even walking. So yes, if we not control this symptom, it might be the outcome of this condition. It will be bad. So because of
Mm.
that, I want to reassure you that our medical team and consultant, they will take care of you. So because of that, they decided to start you this new medication. Do you want me to explain about the new medication?
Yeah, sure, doctor, sure.
Okay, so we will involve a group of doctor, including the nerve doctor and dietitian, and also occupational therapist, physiotherapist, social worker, and other department if we need it. And they decided to start for you two medication called Levodopa and Carbidopa. Do you heard about this medication before?
No, doctor.
Okay, so this medicine mainly given to control the symptom of Parkinson. Okay, it's given orally. It's given a controlled dose that to be treat with the symptom and not too much to cause a side effect. So as any medication, this medicine has a side effect we need to tell you about this side effect. Yes, it might be a little bit disturbing, but I want to assure you that with regular follow-up and with regular taking of this medicine, we can control this side effect. So this medicine actually might have causing for you being sick or some vomiting. Also, it can cause for you confusion, and sometimes you can even see something that is not real. It also can cause some sleep disturbance. But when we compare the benefit of this medication, it's really
Why, doctor? Why I should take such dangerous medication, doctor, with these effects?
yeah, I really appreciate your concern. I know might be a little bit worrying, but I want to reassure you that this is treatment in the best interest of your case, and this side effect can be controlled with a regular follow-up with our department, and yes, it might be controlled. So even the risk of developing this side effect outweighed. It's considered very minimum when consider the risk of progression and the outcome of your Parkinson if not treated. Are you following me with Mr. Richard?
Yes, doctor. Doctor, am I will end on a wheelchair?
Yes, your concern is valid, Mr. Richard.
2 minutes left.
And I'm so sorry to tell you, this disease outcome is not predictable. So yes, there is a possibility that you might end with wheelchair, but
Oh,
if you follow up and with the regular treatment and regular follow up, we might prevent the outcome to become very fast. But there is possibility. There's minor people might develop this, but the majority with this treatment, their symptoms are controlled. Okay. Am I clear, Mr. David? Mr. Richard,
yes. Yes, doctor.
do you have any other concern?
Doctor, there is no like any surgery to get rid of such disease?
I'm not sure. I don't think there's. Actually, I'm not sure. I can refer to my consultant to ask about this about this concern and then give you the answer for this condition. Okay.
Okay, doctor.
Any other concern?
No, doctor.
Okay. Can I ask you some question?
Okay.
With whom you are living, Mr. Richard?
I living with my wife, doctor.
Okay, she can support you at home.
I will need support, doctor.
Yes, sometimes this disease might need the support from yes, the family.
Yes, she's okay, doctor.
Okay, if you need, if you have any financial or social concern, we can refer your name to the social worker. They can help you regard this. Okay.
Okay, doctor.
What's your job, Mr. David?
Actually, doctor, I'm a painter.
Mm-hmm.
And also that was a problem also recently that I cannot control my brush.
Yes, I really appreciate your concern. So with this treatment, this shakiness might be controlled. So let's hope that the medicine work and you can resume your job again.
Okay, doctor.
Okay. Do you smoke?
No, doctor.
Do you drink alcohol?
Occasionally, doctor.
Okay. Okay. So Mr. Richard, are you willing to start this medication?
Okay, doctor, I don't have any choice. Okay, let's give it a
Yes.
trial.
Yes, this medication actually in the best interest in your case and to better to control your symptom and prevent the outcome of this disease.
Okay, doctor.
Okay. I will give you some brochures and some website to read more about this disease and the medication that you use. And if you have any concern, you can call us in our department. Okay, Mr. David?
Okay, okay,
So, thank you so much.
thank you. Actually, I think
Yes,
time's
well
out.
done. Well done, doctor. Yeah, time is, I added some minutes for the last personal and social support because it's very important in such scenario. Anyway, done, Dr. Samia, very well done. Yes, as first practice with this session, it's impressing one. The same for Dr. Ala. Both of you today were too much impressive. Let's start the comment from Dr. Ala, then I will comment.
Actually, well done, Dr. Samia. I think you covered all the things. Only small comments. I think you forgot the name of the patient in between.
Yes, yes, yes.
Yeah,
Yes, I called
this
him Mr. David, yes.
yeah, this one comment.
Yes.
I think in explaining the disease, I think you should start by explaining
Hello?
Yeah, I think the sound from Dr.
the
Ala side.
pathophysiology or the cause of the physiology or or the cause of the disease. Then you start to explain the symptoms and the signs of the disease. And
Dr. Ala, you have some connection issues. There is some lagging or interruption. I'm not sure. We cannot hear you now.
and also the complications. You mentioned the available for the disease. And also,
Dr. Ala, please just repeat
Yeah,
because I
repeat,
couldn't hear
repeat,
you. Repeat again, please.
repeat from the start because there is interruption in your voice. I think he's not hearing us. Dr. Ala, we can't hear you. The good thing this interruption not happened during the discussion.
yeah, I was
During the
complication
scenario.
late when you mentioned late the complications of the disease about swallowing
Dr.
effects
Ala,
and like
you can hear us? Dr. Ala. Dr. Ala, we cannot hear you. There is interruption. Can you reconnect back? Okay, Dr. Ala. You're lucky, Dr.
my voice
Samia.
is clear.
No, there is interruption. We just hear you now.
Yes,
It's clear now.
yes,
Okay,
now it.
but please start from the beginning. No, we can't hear
You
you.
can hear me
Again,
now.
look. Okay, you can talk. No, no, still the problem is there. Dr. Ala, please reconnect back.
Okay, you hear me now.
Okay, we can hear you now. You can start your comment.
Okay. So I was commenting about counseling about
Okay,
this. Okay. Uh, I think it's better to start by explaining the pathophysiology or the cause of the disease. Okay, so the patient can understand more about the disease, then explain the symptoms because Dr. Samia started directly by mentioning the symptoms of the disease that you have Parkinson, which is causing symptoms like this. Then you explain the complications of the disease because you explained it late when you are talking about the medicines. And also then you start explaining about the medicine. You talked about the medicine and also the expected bad effects. I don't know if the term side effect is jargon or no. The person can correct me. But you didn't mention about the safety nets that required, safety netting that required for the bad effect, like drowsiness or dizziness, that the patient should be aware, away from any dangerous objects or like this and take it at the bedtime. I think that's it from my
yes.
side.
Okay,
Yeah.
I agree with you, Dr. Ala, not to forget this point before, sorry to interrupt you. The side effect, if you want to mention the side effect or unwanted effect is the best way. So unwanted effect of medication. Okay, yes, side effect, it's a common name or common term, but if you want to tell him it's something unwanted, it would be much better. but the wanted effect will be outweighs the unwanted effect. Okay.
Yeah, yeah.
Okay,
Also,
continue. Yeah.
another issue also, the patient asked you about surgery, and you mentioned that I think you will refer him to a team or you will check if there is another option. I think you should stick by the management plan which is mentioned in the scenario. That they mentioned in the scenario a prescription of levodopa, carbidopa. I think you should stick with the mentioned management plan. That is the management plan that we are decided for you in the best interest for your condition.
Yes.
Okay.
Yeah, yeah.
Samia, you covered, mashallah, everything. The scenario is very rich and has a multiple.
Yes, actually, I couldn't know the how to define the Parkinson and also if there's any surgery that can help. So I just try to, yeah,
Yeah,
not to go.
covered it.
Yeah, yeah.
But in general, Dr. Sanya, you did great, really. It was good performance. Okay, let's, Dr. Ala, finish comment. I can comment now.
Yeah, yeah. Thank you,
Okay,
Dr.
good
Samia.
comment. Okay, thank you, Dr. Ala. Very nice scenario, as Dr. Maida said, because we are not usually practicing such scenarios, particularly Carbidopa-Levodopa. Okay, let's start from the introduction. Everything was okay, but the point when you asked, I will ask or I will comment about this point, the pathophysiology, how to explain Parkinson in simple way, Dr. Samia. If I give you a chance again to explain, how could you explain it?
I'm just telling that it's a long-term disease that
Okay,
might
it's,
affect.
yeah, but why it happened? Due to,
Okay, could be idiopathic. There's no
yeah, there
known
is,
reason for.
exactly.
Yeah.
Sometimes, which is called, this is the most common form of the disease, idiopathic one, but mainly because of breakdowns of some of the brain tissue, right? And
Yes. Yeah.
this, yeah, particularly some of the
Yes,
mode of the nerve movement inside the brain getting slow. That's why you have this issue, right? You have this
Okay.
stiffness, you have the slowness of the movement, and so on. The complication, I would like you to add the dementia and depression, one of the most and common serious complication if not treated well or if not controlled by the medication. Okay, you have to mention them. Apart from that, yes, difficult swallowing and disability, everything, even sometimes patients might be bedridden and they end up with, for example, a big tube or a tracheostomy or whatever, according to the condition. Okay. So according to the plan of management, the teams, you mentioned every team, social physiotherapy, and the specialized nurse. I would like to add the SOL team, swallowing and language therapist team. Okay, this is the only team you missed. The nerve doctor, of course, you have to mention also the clinical pharmacist because all this medication having side effect, and he should know about the side effect, and he should tolerate, he should know how to tolerate it. As Dr. Ala mentioned, the medication should be taken before sleep and avoid, of course, driving. This is one of the side effects, drowsiness, and also there is other complication, gambling, and also a patient wearing off phenomena. Sometimes at the end of the dose, the patient will have the manifestation of the disease again. So you have to know all these things. The good question also Dr. Ala offered here, or yeah, the good question about why they didn't give me this medication earlier. Usually, we give this medication whenever you have the symptom affecting your daily activity. Otherwise, because of the side effect or because of the bad effect of the medication, we postpone or we make it later on, whenever your symptoms affected your daily activity. This is a good question, and Dr. Sami also answer it in good way about weighing the risk and benefit as well. It would be the answer. But again, you can tell the activity, if affected by the disease, or the motor, particularly the motor part of the activity, which is the movement, if affected harmfully, we will start this medication, as in your condition. The social support should be offered here, but don't give financial support. Even the patient, he needs some financial support because his job will be, or he will be retired from the job. You can tell him, we will support you socially if you need. I wrote also in the comment, whenever you have patient with occasional drinking, you have to ask him, are you binge drinking? What do you think the importance of this condition or of this issue, Dr. Samia? Why I ask about binge drinking in such scenario?
Drinking, I think, in itself, it can cause some tremor and some problem.
Yeah, the
Maybe it might
toxicity,
spread.
yes, exactly.
Yes.
So the toxicity or alcohol toxicity, excess alcohol intake might lead to the same manifestation, tremens, which is tremors and worsening of the condition, Parkinson, plus the unsteadiness, it might be there, and the patient will have risk to fall more and extremely more than the disease itself, right? So he will hurt himself because of unsteadiness. He already is having some difficulty of movement and the slowness of the movement. And now he's drinking binge drinker or he's drinking excess during the weekend, he will have the more risk to have a fall. So you have to ask this question whenever the patient is drinking occasionally. Okay. The other point I wrote down, yes, depression, dementia. Yes, dementia, which is decrease. The memory issue might be affected. Even the awareness of the surrounding might be affected, particularly with the Parkinson patient. And these are the most serious complications. What you are afraid from in any condition, coma or the mental activity or the memory issue, all the things, the most serious thing. Otherwise, patient might tolerate the tremors with the medication, or even at home if he's sitting, okay? Or he can't even be awake. But if he lost the awareness, nothing will be benefit for this patient, right? So whenever you are talking about complication, you have to start with the most simple complication up to the most serious complication. Why? Because this patient should know about the outcome of the disease and why he's gonna take this medication. He should be controlled. For what reason? Because if not controlled, he will be end up with bedridden or even coma or dementia or whatever the most serious complication. Okay. Always start with the simple, but even explain to him the serious one.
But
Otherwise, Dr.
sorry,
Sam, yeah, yes,
sorry, Dr.
go.
Bassem, for interruption.
Okay, Dr. Ash, continue.
Just because, to be clear, this medication will not delay this complication. Just we give
Sometimes,
him medication for symptomatic management to be
yes,
your daily activity, to be not to worry about your symptoms, especially the tremors. So it is for management the symptoms, but
yes,
it's not affecting the progression of this, and this is why they didn't start it early. Because if no problem with the symptoms, they will not give you medication. Already Parkinson
exactly.
progressive, we can't control it, the progression. Or even they may giving this L-dopa with increasing dose to control the symptoms more and more, increasing dose by time. Because it is not, this is will progress. It will end with disabilities, and we can't prevent that. This is liver is a bad news to the patient diagnosed with Parkinson because disabled the condition, and even the medication will only hide the symptoms, but the progression of destroying of these cells
Yes,
in part
you're
of
right.
your brain, we can't control it. Nothing
Yes,
till now, it can prevent the progression. Just
yes,
all the modalities and all the new modalities controlling the symptoms that the patient will suffer from. So improve the quality of life.
yes. Perfect. Thank you, Dr. Aisha. So the aim, as Dr. Aisha mentioned, this is the aim of the medication to control the motor symptoms. but the disease will progress whatever the medication. Yes. Okay. I think I finished my comment. Anyone has comment? I will read Dr. Tasneem comment. Damage to the nerve cells in certain parts in the brain. The cause of it is not known. These cells are responsible for reducing certain chemical called dopamine, and it's working in deregulating fine movement and motor function. Its deficiency causes the manifestation you have. Perfect. Again, everyone has his approach, his way to explain, but please, the main and the general rule, don't complicate the explanation. So you are explaining not to give more complicated words or using complicated and medical terms. Be always simple as much as you can. Okay. Another comment. Anyone
So
has
doctor,
comment?
what regarding the cervical?
Yeah, deep brain
Yeah,
stimulation.
I have question.
Deep brain
Okay,
stimulation, one of
I
the
have to
possible.
mention. Okay.
No, if he raise it or it was written, and in this scenario you can raise it, and he is already raised it by himself. But it was mentioned in the scenario, give him the possible management plan. So I agree to mention it. In advanced stage, we can think about surgical option, which is called deep brain stimulation. But we'll not go through this now because we have to start with this medication first, because this is your task. Okay. But you have give him
Okay.
option of surgery because there is possibility to reach to that surgical option. Okay. Yeah, the problem of the name, Dr. Samia, be careful about this. If you forget the name and you think you are pronouncing the name wrongly, tell him sir. Okay. And for the woman, you can say ma'am or madam. This is as diplomatic solution. But please be sure about the name. Don't mention wrong name.
Okay, inshallah.
Okay. Thank you. Well done, Dr. Sam. Any other comments? Dr. Muhammad Galal, if patient knows his condition, we can explain the condition to him? No. That's why Dr. Samia asked him, do you want me to explain about the condition? And when he answered yes, he started to explain, or she started to explain. But if the patient told her, no, doctor, I know everything, please, I don't want to know more, no need to go further. Don't tell her anything about the disease. Okay, why? Because you have another task to go through. You have another issue to ask about, like the social, like the driving, like smoking, alcohol, personal, plus the task, of course. Clear? Other comment or questions? Really, it was a very nice session with good performance, both of you, Dr. Sami and Dr. Ala. Nice scenarios as well. And
About the scenario, Dr.
yes,
Bassem, because I don't know exactly. They also only mention L-dopa and Carbidopa in the
yes, this is the scenario. Carbidopa-Levodopa or Levodopa-Carbidopa.
And about the complication, you mentioned the confusion. Anything about the postural hypotension mentioned in scenario,
Yeah, Dr.
like in
Samia,
complication?
yeah,
Yeah.
she touched it. Yeah, so
Yes,
you
you
might
should
have
be
heard it.
careful on standing from sitting,
Yes,
and also you should take in the early of the day because it's causing some also sleep problem.
yes, exactly. It should be taken before sleep, you mean, right?
No, it's causing like insomnia. So it can you will take it in the early morning, and also for symptoms relief because it will be the the peak of action will be at morning. So you will take it in early morning because
Early or
after that,
late?
L-dopa will not affect take the same action. After that, there will be like off phenomena that we know. So it's taken in the early morning. Yeah.
Okay, let's ask Dr. Rabia if she's with us. Neurologist, yes. No, she is not, right? Dr. Rabia? No, she's not with us. Okay. Let me confirm, or someone can update or search about it, what the dose or when the dose will be given, and so on. Okay. Because we know all of us about the complication, but what the duration or the onset of the action, what to take or when to take the medication? Anyway, it's not major issue to be explained in the basis wise. So you might tell the complication, and regarding the dosage, it might be explained in another meeting with the nerve doctor if you are having doubt about this. Okay. Any other
Yes,
comment?
it is better.
Yeah,
Yes.
thank you. Yeah, thank you, Dr. Ash. What about driving here? Yes, he should ask about it, or she should ask about it. Because this patient is having resting tremors, and the driving is one of the resting
It is
things.
already having, I searched it's taking 3 to 4 times per day, so it will
Mhm.
not be issue to say
Okay,
anything about that.
okay.
It,
So
it,
no,
it
not
is
not
many times per day, yes.
yeah, yeah. It's nothing before or after or while waking. Nothing. Okay, 3 times daily. Okay,
Yes, it
if
is small
patient know,
doses many times, yes.
yeah. Okay, well done, Dr. Aisha. Thank you. Anyone would comment? Any other comment? Any question or doubt? Driving, yes, we have to address it. Driving should be raised. Why this patient is having tremors? Okay, it should be addressed. Do you drive? The same as his job. What's his job? Your job? I'm
I
a
think it's
painter.
about also the stiffness and the bradykinesia of the
Yeah, yes.
Parkinson.
Of
It is
course,
more,
all will affect
yes, with
driving. Yes.
tremors, yes. Because it's
Okay.
resting tremors, so I think it's better to
Yes,
say because the symptoms at all.
exactly. To stop, you mean? Yeah, to stop, of course, to stop. To stop driving, yes. Okay, Dr. Rabia, sorry. Any other questions? You understand it, Dr. Ilaf, now? So you have to stop driving. Or refer him to DVLA because this is long-standing disease with progression or with progressive course. So you can refer him to the DVLA and they will address it. Maybe his symptoms might be improved in the future. At this time, he might drive. So let's refer him and we will reassess him back after controlling the tremors. But temporarily, since he's having tremors, we should stop driving. Okay,
About
thank you.
missing doses, Dr. Bassem, sorry, about missing doses, do we should mention this also in precaution, like if you miss, please don't miss any
Yeah,
dose.
yes, yes. By the
And if
way,
you
the
miss the dose,
compliance,
take it as
whenever you remember, yes.
whenever you remember, yes. Because
The
it is also very
compliance,
big problem when you missed any dose
yes,
from Parkinson, it having a very bad effect. Yeah.
exactly, yes. Any medication, not only taking the medication, even the compliance and adherence to medication is very important. So you have to talk about the adherence plus the continuation of the medication. Okay, to be adherent in the same timing, don't miss the dose, compliance, all these things will help to relieve the symptoms and the disease itself. Okay. Any other question or comment? Thank you everyone, Dr. Samia and Dr. Ala. We'll end the session now.
Thank you, Dr. Basim, for the
Most
chance.
welcome.
Really
Thank
informative.
you.
Thank you.
Yeah, thank you. Most welcome. Thank you everyone. Thank you, Dr. Maida, Dr. Aisha, and Dr. Yak, all the attendance. See you tomorrow, inshallah, with the short clinical day. I hope the one will do it to prepare a CNS or nervous system station because we didn't do it since long time. Anyone interested to do the case? Message me that privately. See you tomorrow, inshallah. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.